Hi, everybody. Welcome to the presentation today titled mHealth Technology to Prevent Preventable Stillbirths. I'm Megan Aucutt, Program Director with Healthy Birthday, Inc., the nonprofit organization that created Count the Kicks. I'm excited to be here today, and I'm excited to introduce you to Shawn.
Thank you, Megan. Hi, everyone. My name is Shawn Soumilas, and I have been the Arizona Ambassador for Count the Kicks since 2013. I do this work in honor of my son, Zach, who was stillborn at full term in 2010.
Thank you, Shawn. We have no conflicts of interest to disclose. So what is Count the Kicks? Count the Kicks is a highly effective, evidence-based stillbirth prevention campaign. We developed an early warning system for moms, and we are saving 1 in 3 at-risk babies in Iowa, where the campaign was created. Our campaign is ready to go and low cost.
Stillbirth is a lot more common than people know. Nationally, 1 in 169 pregnancies end in stillbirth. And sadly, racial disparities are large. For Black moms, it's 1 in 96. In Hispanic moms, it's 1 in 199. For Indigenous moms, it's 1 in 138. For white moms, it's 1 in 204. And Asian Pacific Islanders, it's 1 in 233. Going back to Black moms, they are unfortunately 2 to 3 times at higher risk of stillbirth, depending on their state. Stillbirth is just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. Looking at the Arizona data specifically, in 2019, the stillbirth rate in Arizona was 6.1 deaths per 100 births. The 5-year average is 5.9 deaths per 1,000 births. In Arizona, we're not doing that great. There has been no improvement for over a decade. Specifically, Black and Indigenous moms are at much greater risk, as indicated by the data. Arizona loses around 490 babies every year to stillbirth. If we implement Count the Kicks, as has been done in Iowa, we have the potential to save around 158 babies a year from preventable stillbirths.
So when we talk about a 32% reduction in stillbirths in Iowa, or the fact that we're saving 1 in 3 at-risk babies from preventable stillbirth, what we mean by that is shown on this graph here. So in 2008, Count the Kicks was created. It was founded off of research and evidence by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. Taking this research and evidence, they created this empowering, uplifting program that educated expectant parents on the importance of tracking fetal movement in the 3rd trimester. In the first 5 years of the campaign, we saw about a 39% reduction in the number of stillbirths among Black women. In the decade 2008 to 2018, we had a 32% reduction in the number of stillbirths here in Iowa. And we've seen a significant decrease since then from 2008 to 2021. Our preliminary data shows that our Iowa stillbirth rate is 4.1 fetal deaths per 1,000 live births, the second lowest Iowa stillbirth rate since 2003. In 2018, the stillbirth rate was 3.9. So we want to bring this trend, this decrease, to other states and states just like Arizona. And we're excited to be launching in Arizona this month. The slide you see on your screen now is an image of a poster presentation for the International Stillbirth Conference that took place in 2021. The purpose of this study was to assess the effectiveness of the Count the Kicks stillbirth prevention campaign, including how expectant women use the Count the Kicks app during their pregnancy, if the app was effective in helping mothers track their baby's movements, if the app increased awareness of a change in fetal movement, and if so, the health outcome of their baby or babies. A total of 809 women that had previously used the Count the Kicks app completed a self-report survey on their pregnancy outcomes, medical care, experience with the app, and birth outcomes. Analysis showed significant decreases in women's pregnancy experiences when they used the app to track fetal movement as compared to pregnancies when they did not use the app. Use of the Count the Kicks app was associated with significantly greater adherence to clinical kick counting recommendations, increased knowledge of movement patterns, and identification of a change in movement. Women that tracked on a daily basis reported a significantly greater understanding of their fetal movement pattern. Use of the app was also associated with reduced anxiety and increased maternal bonding. 82% of women reported less anxiety when using the Count the Kicks app, and 51% of women reported Count the Kicks helped with bonding. So now that you know about the evidence behind Count the Kicks, what exactly is it and how do you implement it with your patients or clients? Count the Kicks teaches the method for and importance of tracking fetal movement during the 3rd trimester of pregnancy. Research shows the benefits of expectant moms tracking their baby's movements daily and learning how long it normally takes their baby to get to 10 movements. After a few days, moms will begin to see a pattern, a normal amount of time it takes their baby to get to 10 movements. If their baby's normal changes during the 3rd trimester, this could be a sign of a potential problem and is an indication that the expectant mom should call her healthcare provider. We develop the tools and resources for those that work with expectant parents, such as yourself, to be able to talk about stillbirth and stillbirth prevention, and the tools and resources for expectant parents to know and understand the importance of tracking their fetal movement during the 3rd trimester. One of those tools is our free Count the Kicks app. Our app has been downloaded over 160,000 times and is in over 140 countries. First, let me note that there are no advertisements or pop-ups on our app to distract moms or slow her kick counting sessions. We continually survey our app users and listen to their feedback to make changes. Our app is completely free. It's in 14 languages. You can see some of the features on your screen right there. I highly recommend that you download the app in your app store right now so you can begin to use it and see just how user-friendly it is. As you can also see, it's very visual. So right there, you can see a graph of somebody that's been using the app, and it takes that baby about 15 minutes to get to 10 movements. So that graph will change if it takes significantly longer. If that, mom's been counting and it usually takes 15 minutes and all of a sudden it takes 45 minutes to an hour, for example, that graph is going to shoot up, and that's going to be a visual change. So that mom can call her provider and work with her medical team to determine next steps. While our app is free, there's a lot more to the campaign: educational materials, trainings, social media. We want to replicate the success we've seen in Iowa and other states. And as of today, we're currently launched in 16 states. And I'm so excited to share that Arizona has officially partnered with Count the Kicks to launch the stillbirth prevention campaign right here in your state. The Arizona Department of Health Services is working closely with us at Count the Kicks to ensure everyone that works with expectant parents knows about this campaign.
Thanks to this partnership, you can order free materials to aid you in talking with expectant parents about Count the Kicks. Order these materials at countthekicks.org and click on Order Materials in Arizona. Fill your shopping cart. There are free posters like you see on your screen, free brochures, and app reminder cards. We are also translating material into Navajo and Swahili. Thank you to the Arizona Department of Health Services for saving babies with us. These are just some of the beautiful babies who have been saved by Count the Kicks, their moms and their healthcare providers. These faces are all across the US and are living proof that Count the Kicks works. In many of their stories, their doctors say they would not be here if mom didn't speak up when she noticed a change in movement. Thank you for saving babies from preventable stillbirth with us in Arizona.
All right, thanks for that. Let's see, Megan, I see you, and Shawn, I saw you a second ago. There you are. Oh, it looks like there's some comments in the chat. Frida Espinosa says, my daughter was born in Des Moines with awesome midwives at Broadlands. I didn't realize Count the Kicks was an Iowa thing. Thanks for your work and presentation.
Yes, that's awesome. Congrats to her. Yes, Broadlands here is a local medical center in Des Moines. So I'm based out of Iowa in Des Moines. And Shawn is obviously in Arizona, but we are a national organization. So excited to be here today.
Great.
Thank you. Yes, we're very excited to be here today.
How is the work funded? You were saying that there are no ads, it's a free app. So how is it that you've managed to kind of spread out to 16 different states?
Sure. So while the app is free, that's usually funded through like our internal organizational budget and from various grants. So whenever we need a language updated, we'll seek out funding for that, for grants. Sometimes with state health departments, they will fund us through like their Title V funds from maternal child health. And so a lot of times state health departments will say, you know, we really need this in a language that you don't have yet. Can we work with you to get it translated? So for example, Arizona is a perfect example of this. We have materials that are geared more towards somebody that doesn't speak English or English is not their first language. And they wanted those materials to be illustrated and translated into Navajo for one, so poster and low literacy, and brochure, and then Swahili was the other one. So that was the first state that we did this for. And those are live on our website. So you guys can all order them for free. And that's through funding with the health department. So for the majority of these states, it's usually funding through the health department. Sometimes it's from perinatal care collaboratives, MCOs, but for the most part, I would say out of the 16, 14 are health department funds. So somebody said,
That's great. I'm happy to hear that.
Yay.
And congratulations.
Congrats. Yes, congrats. Yeah, so we're just getting started in Arizona. You'll see mailings go out and social media will be out. We'll be doing a letter campaign to OB providers and midwives and doulas. So anybody that you think we should be connected to that works with expectant parents, we definitely want to know their contact information. We can do trainings about how to implement Count the Kicks, how to talk about fetal movement monitoring with your patients. It's super simple, easy to do. The app makes it easy. So yeah, it's pretty turnkey. And once you kind of get that information, education, we're ready to go. So.
And anybody's welcome to reach out to me. If you don't have my contact information, I am on LinkedIn. And also I think Liz, you know, if Liz can share that with anybody, I'd love to talk with anybody interested in spreading the message more in Arizona about Count the Kicks. So this is going to be an exciting year.
Yes. Thank you guys. We appreciate your work, and we'll be sharing the recording, and we'll put a list together with your contact information, since I don't think we have slides for this one, but we have the recording and we have your contact. And if it's okay with you, we'll share that. And in the meantime, you can maybe put your emails in the chat, and then we'll be sure to share those as well.
Sure. And I'll share the slides with Liz. I can share those easily. Thank you.
Awesome. Thank you.
Thanks.
Thank you.